Right. So my name is Faith Mdianyama. I'm the registered manager for TSF Healthcare Solutions. And our company is a domiciliary care company as well as providing complex care services in the community. So yeah, that's it really. So like when it comes to domiciliary care, we're looking at personal care, waking nights, live-in care, and then the complex care needs is where you have people being discharged into the community, obviously, and they need, like, they've got complex care needs. People with PEGs, you could have those with stoma bags, people with catheters that need like catheter care, those on vents that need ventilation. I'm a nurse by profession, so I've been practicing as a nurse for some years now, up to 20 years. So this is something that just comes naturally because I know how to do it. And I just thought maybe I need to do something for myself. Possibly start like preparing for an exit strategy, really. Like when it comes to the time when you're not going to be able to work, do you have something that can sustain you? So my partner and myself then decided to go into this business, and because it's, like I said, this is something that just comes naturally and something that I can do. And so that's how I got to start the business and got myself registered, with my partner supporting me as well. So we kind of like complement each other because I've got my strengths and my weaknesses and he's got his strengths and weaknesses, and then we come together so that we have something that's quality, quality services, yeah. Well, we have gone into a business where we've got relatively people that have been in the business for a long time. So the competition is there. But for myself, I feel like because I've been working as a nurse, I know the needs that people have when they are like at their worst, when they need somebody to be supporting them. So by being that person, I know that I'm very compassionate, and I try by all means to ensure and make sure that the healthcares that I employ have the same sentiments that I have, being very compassionate, being very caring, so much that when they go out, I know I can trust them to be that person that's very compassionate, and hoping in the end that we won't have any complaints coming back, because they are providing quality services and they're being compassionate, very empathetic as well. So I think that's what makes me different from the other companies, because I have the experience and I'm also imparting that knowledge that I have on the staff that we've got as part of our team. As the registered manager, so if somebody wants to onboard within our company, I have to go and do the pre-assessment. So I go and do the pre-assessment, basically just going to do and assess the needs of this person. Are we able to meet the needs? And when I've done the pre-assessment, then I then tailor their needs so that at least we can meet their needs, get the risk assessments done, the care plans done, also allocate staff that I know they can meet the needs of this person. So, and once they're on board, I do like regular reviews with the family. If there's any change in the care needs, we can also tailor the needs as well, reflecting the changes that are there. Also, as part of being the registered manager, I have to see that everything's running smoothly there. There are no hiccups. On the managerial side, like always making sure that you've got your audits done, is everything being done when it should be? Because in as much as we want to run the business, we also have a regulation board that we have to follow their rules, like the CQC. So I've got to make sure that everything that's done as expected. I can take, for example, we have one client. So she's got like a very big package of care. So she has a lot of calls. So we've got carers going in, but there are times when I feel I need to go and see what's going on. So I then went yesterday and I found her to be having like pressure areas were like really getting not so good. They didn't look good. So being the registered manager, I have to react. So I've contacted the district nurses. I've let them know that they need to come and have a look. I've done taking the pictures using CareLineLive. I need to do an incident report as well. And I know the district nurses would have done one. But I then met the district nurses and they had said, oh, we've got these things that we're going to put in place for her. We're going to put an airflow mattress just so at least she's not going to have any damage to the pressure areas. Is there anything else that you feel that we need to provide for her? Because already there are other things that we had asked for them to put in place. So I said, oh, well, maybe if you can provide the hydromort ointment, maybe we'll see how that goes, because she's got other barrier creams, but we want to try something else. And the district nurses are like, okay, so we'll be coming in every Monday to see how she's doing. So if I hadn't gone to see what's going on, maybe I wouldn't have known. And by the time I would have found out about these pressure areas, it may have been too late. And then if it was too late, then we've got more problems than anything else, because now you're going to have probably safeguarding being put in place because you are not reactive and you're not like maintaining patient safety. You're not doing the right thing for this person under your care. So by doing that, I've solved a lot of problems that would have come forth if I hadn't gone. So I make it a point to also make sure that I do go out with the carers and just see how they're doing. If there's anything that I feel like they need more training on, I also provide the training for them. We also have a form of like, on the CareLineLive, we can communicate. I can send a message, a handover note for the next person, and then the next person can also see what's going on. But sometimes I'm not part of the care staff, so I have to be on the manager side and have to really put my foot down to say, no, we need to do this right. You guys are not doing this right. You're missing out on this and that, so I think I've got a lot on my hands, but I think in the long run, we'll just share the work. Probably get some care coordinators, some team leaders, and that will also help, because at the moment, it seems like I'm doing more and there might be a time where I might be overwhelmed. So I'm going to have to share out the work with some other people. Well, I find it's user-friendly, I must say, because we did try another software package and it wasn't so clear. It was quite confusing, but I think with CareLineLive, it's really straightforward. It's user-friendly. There's not like it's not too much detail, but it's just straightforward. Anybody could understand how to use it if you've been trained. So I find it quite easy, and even the families are also using it to get to see, like, on a daily basis, stuff about their family members. I haven't seen anybody communicate anything as of yet, but I feel like they're happy with the way they're managing with the CareLineLive, and even the healthcare assistants that we've got, they seem to be managing fine with it as well. On the managerial aspect, it is quite easy to navigate through it once you get the hang of it. So I think, yeah, it's all right, yeah. If you're doing the training and it is hands-on, it's much easier rather than watching a video. But if you have somebody telling you, like, if you click here, if you click there, it makes more sense. And also you've got somebody on the other line, like there and then if you need help. So you've got somebody who's always there to give you a hand if you're stuck with anything. So I'm happy with the service so far. I've got no complaints. That is a really good asset on CareLineLive, really, because there was a time when I went out to see a client. I logged in, but I forgot to log out, and I logged out when I was like miles away, and it flagged up on the system that this person did not like log in, like log out within the area. And obviously you're learning as you make mistakes. So obviously I've learned. Well, I haven't had much experience with GP Connect, but I know that I can get access to the service users' notes, even connect with the GPs and communicate with the GPs and stuff. So yeah, I think it's a good system in place. Yeah, the care plans, we would do them like separately, and then you're able to upload them onto CareLineLive. So the carers have, like, if they need to refer to any of the care plans, they are there on the documents on the CareLineLive. So I find it's quite easier for somebody to be able to, if they're stuck on anything, they can always refer to the care plan. Even families have access to it as well, so they can get to see the documents and see the care plans as well. And if they feel there's anything that needs to be changed on the care plans, then they're able to do that. So I feel being able to upload the care plans all on a one system that everybody can have access to, I think it's quite useful, and it's a tool that's quite handy. Well, having a software management system that does most of the things, it's actually doing most of the audits and everything. So if CQC were to say, oh, we're coming next week, I don't think I would have any problems because everything is on the software management system. So it would just be a matter of pulling out the data and then just showing them what you've been doing. Yeah. So I feel if CQC were to come in, everything would be fine, really. Yeah. I like when you're able to raise a concern, also take a picture using the CareLineLive, and everything's uploaded on there. I feel actually it's a system that actually safeguards everything under one roof, so that you're not gonna have photos being leaked. Like, say if I needed to upload a picture, I've seen somebody with a skin tear. If I were to use my personal phone to take a picture, there is a chance that that picture can land in, somebody can hack my phone. But like with the CareLineLive system you're using, when you're on it, nobody else can get access to it unless if they have the access to the app. But if they don't, then they're not going to see what's in there. So I feel like the service user's information is protected. And by using these tools, like taking the photos and reporting the concerns, everything's under one management system. So I think that that safeguard of protecting people's information from being leaked, I think it's really good. Yeah, it is. And like I said, the system is just good, really. I mean, for rostering, even if say you've done your roster, everybody gets to see when they're at work, who they're working with. Even on the managerial side, you get to see and you can play around with the roster. It's really good, really. Mm-hmm. Well, we had another system that we were using, so we had to switch to CareLine because it wasn't, well, we didn't feel it was worth the money that we were paying for. So we never used like paper-based. We were always like using software, because I think when you're using software, it just makes life much easier. But you would want something that goes hand in hand or at par with what you want and the quality of services that you want. So at the end of the day, obviously, you would look for a system that you feel you are happy to use. So switching from one system to the other, I think it was a good choice. Yeah. Well, to other providers, I know change is something that's very difficult, and nobody ever wants to have that change process. But with CareLineLive, I would advocate for people to really use them, because the support we've had was just great, really. And we don't have any issues that we don't think that the team from CareLineLive can solve. Everything is just like smooth sailing, really. You've got your invoicing, you've got your roster, you've got everything under one roof. And I feel you only know when you've got somebody giving you a review and telling you that this is the system to use. And to other providers, I would be happy to say they should try CareLineLive, and they would not go wrong with it. Yeah. Well, I think the biggest challenge is that there are a lot of providers at the moment. So you find it might be difficult to be able to get service users to like on board with your company. But at the end of the day, I believe if you're doing things right, everything just falls into place, and you won't have any problems of like getting service users on board, because they're being like, it's now a market where you've got lots of providers. But when you have lots of providers, I believe at the end of the day, it's the quality of the service that puts you above the rest. So if you're providing good quality services, you're always going to be like, you're going to stay afloat. But if your service is not so good, obviously you're going to lose the clients. Your business is just going to go down. So in as much as we have a lot of providers, at the end of the day, what sets you above the rest? So if you're providing that quality service, and I know some people may not want to invest in software management and they want to use paper-based, just trying to save money. But at the end of the day, it's the quality of the service that you get when you're putting in that effort. So if you use the software management system, you're always going to bring out quality services, because you're not going to have any hiccups where you've got no staff on, you don't even know who's on, who's turned up to which call. But if you have, like, let's say you've got your software, you know, so-and-so's at that call now, the call's been completed, you're not going to have any problems where people are going to be reporting nobody turned up for the call, but you might be having problems because you're wanting to do things paper-based. So you're probably creating more problems for yourself.